Have you ever been woken up in the middle of the night by your dog? Not by them jumping on the bed or scratching at the door or doing one of those full-body shakes that rattle their collar tags. Something different. Something that pulled you up from deep sleep to sitting upright before you were fully conscious of what you had heard. A sound. Coming from somewhere in the darkness of your room or the hallway. And in the 3 seconds it took your brain to fully wake up and locate the source, your heart was already beating faster than it should be at 2 in the morning. You found them. Maybe they were standing in an unusual place. Maybe they were sitting when they should have been lying down. Maybe they were completely still in a way that dogs are not usually still. And they were making a sound. A sound you have not heard them make before. Or a sound you have heard but always in a different context, always during the day, always followed by nothing, always explained away. But here, at 2 in the morning, in the dark, that same sound felt completely different. You turned the light on. You went to them. You checked them over with your hands the way you do, the way every scared dog owner does in the dark, looking for something obvious, something you could see or feel that would explain the sound and let you both go back to sleep. And maybe you found nothing obvious. And maybe your dog seemed okay. Maybe they settled. Maybe you lay back down. But you did not really sleep after that. Because the sound stayed with you. And somewhere in the part of your mind that was still awake at 3 and then 4 in the morning, you were turning it over. Trying to decide what it meant. Trying to decide whether it was serious enough to act on in the darkness or safe enough to wait until morning. This video is for that moment. For the middle-of-the-night version of you who is lying awake with a dog whose sound you cannot explain and a question you cannot resolve without more information. I am going to give you that information right now. Because some of the sounds that dogs make at night are safe to observe until morning. And some of them are not. And knowing the difference is not a matter of being overly cautious or overly relaxed. It is a matter of having the right information at exactly the right time. Hello everyone. I am Dr. Patrick Sullivan, and welcome back to Paw Secrets Lab. I have spent over 17 years in veterinary emergency medicine and critical care. The nighttime phone calls, the 2 a.m. arrivals at the emergency clinic, the families sitting in the waiting room at 3 in the morning, these are my professional world. And I can tell you with complete clinical certainty that the question of when to act on a nighttime symptom versus when to wait until morning is one of the most important questions in companion animal emergency medicine. Because the dogs who arrive at emergency clinics in the middle of the night do not all present the same way. Some arrive dramatically distressed. Some arrive quietly, with owners who were not sure whether they were overreacting, who almost waited until morning, who made the right call in the dark with incomplete information. And some never arrive in time at all because the decision to wait until morning was made about a sound that did not have the luxury of time. What if I told you that there is a specific framework for evaluating nighttime sounds your dog makes that tells you, clearly and precisely, whether you are dealing with something that can wait for a morning appointment, or something that requires you to get up, get dressed, and go to an emergency clinic right now? A framework based not on how dramatic the sound is, but on the specific biological characteristics of what produces each sound and what each sound's presence at night tells you about what is happening inside your dog's body. Today at Paw Secrets Lab, we are going to build that framework completely. Here is exactly what we are covering. In Chapter 1, I am going to explain the nighttime symptom biology. You are going to understand exactly why certain conditions become symptomatic at night specifically, and why nighttime presentation of certain sounds is more clinically significant than the same sound occurring during the day. In Chapter 2, I am going to reveal the 7 nighttime sounds. Each one with its specific biological origin, its most common causes, and the precise threshold that tells you whether to wait or act now. In Chapter 3, I am going to teach you the middle-of-the-night assessment protocol. This is the specific sequence of observations you make in the first 3 minutes after you hear the sound that gives you the information you need to make the right call. And in Chapter 4, I will give you the absolute non-negotiable sounds and sign combinations that mean you are already on your way to the emergency clinic before you finish reading the list. Subscribe to Paw Secrets Lab right now and join our extraordinary, growing community of educated, devoted dog parents. This is one of those videos you genuinely hope you never need to use and simultaneously need to watch before you need it. Let us begin. Welcome to Chapter 1. The Nighttime Symptom Biology. Before we decode the specific sounds, you need to understand something that changes the entire clinical weight you should assign to symptoms that appear specifically at night. Because nighttime is not simply daytime in the dark. It is a physiologically distinct state that creates specific conditions under which certain disease processes become symptomatic for the first time or worsen dramatically. Here is the biology. During sleep, the autonomic nervous system undergoes a fundamental shift. The sympathetic nervous system, which is responsible for the active, alert, fight or flight responses of waking life, reduces its activity. The parasympathetic nervous system, which governs rest, digestion, and cellular maintenance functions, becomes dominant. This shift produces measurable changes in virtually every physiological system in the body simultaneously. Heart rate slows. Blood pressure drops. Respiratory rate decreases. Gastrointestinal motility changes. Hormonal secretion patterns shift. The body redistributes blood flow, directing more toward the organs engaged in repair and maintenance functions, and less toward the muscles and tissues engaged in active function during waking hours. This parasympathetic dominance is essential for health. It is when cellular repair happens, when the immune system does its most active work, when inflammatory processes that were suppressed during the day by stress hormones are allowed to run their natural course. But here is the clinical significance of all of this for your dog's nighttime sounds. Several serious disease processes are specifically unmasked or dramatically worsened by the physiological changes of sleep. Cardiac arrhythmias that are suppressed by sympathetic tone during the day become apparent when that tone drops at night. Respiratory conditions that were compensated by the muscular effort of waking life become decompensated when the muscles relax during sleep. Pain that was distracted by daytime activity and stimulation becomes impossible to ignore in the quiet, still, sensory-reduced environment of nighttime. And gastrointestinal catastrophes, some of the most life-threatening conditions in veterinary emergency medicine, frequently develop their initial symptoms at night for a specific reason. The dramatic reduction in physical activity during sleep means that a dog who is developing gastric dilatation volvulus, torsion of the stomach, or intestinal obstruction is not moving around in ways that would make the early symptoms obvious to an awake observer. They are lying still, in the dark. And the first symptom you detect may be a sound. This is why nighttime sounds carry different clinical weight than daytime sounds. The physiological context in which they occur makes certain sounds more diagnostically significant at night than they would be at noon. A dog panting at noon after a walk is a dog cooling down. A dog panting at 2 in the morning having been asleep for 4 hours is a dog whose body is communicating something that requires a completely different level of attention. The nighttime is not neutral. It is a diagnostic context. And the sounds your dog makes within it are signals filtered through that context in ways that make some of them considerably more urgent than they would otherwise appear. Welcome to Chapter 2. What each sound is telling you. I am going to walk you through each of the 7 nighttime sounds with the specific biology behind it, the most common causes, and the precise threshold that tells you whether this is a wait until morning sound or a get up and go now sound. Nighttime sound number 1. Rhythmic panting without heat. The sound. A steady, continuous panting at a rate that seems faster than normal breathing. Not the deep, slow breathing of sleep. Not the sharp panting of a dog that has been running. A persistent, rhythmic panting that continues for minutes rather than seconds in a dog that has been resting. The biology. Panting is a thermoregulatory behavior in dogs, the primary mechanism for releasing excess body heat. At night, in a cool bedroom, in a dog that has been resting for hours, there is no thermoregulatory reason for panting. Nighttime panting in a resting dog, therefore, is almost always driven by one of 4 non-thermoregulatory causes. Pain, which triggers panting through the sympathetic nervous system activation associated with the pain response. Anxiety, which produces a similar sympathetic response. Cushing's disease, which is excess cortisol production that dysregulates the stress response system and produces persistent panting as one of its most characteristic symptoms. And cardiac or respiratory compromise, where increased effort is required to maintain adequate oxygenation. The threshold. Panting that has persisted for more than 10 minutes in a resting dog at night, in a cool environment, with no obvious behavioral anxiety trigger, is a sound that requires you to get up and assess your dog. If the panting is accompanied by any of the additional signs I will describe in Chapter 3, it may require you to do more than assess. Nighttime sound number 2. The honking cough. The sound. A sudden, forceful, honking exhalation. Sometimes described as a goose honk. Sometimes described as a deep, harsh cough that sounds more like a bark than a cough. Typically occurring in clusters of several honks in a row followed by a period of apparent normalcy. The biology. The honking cough is produced by sudden, forceful movement of air through a partially obstructed or collapsing airway. The most common cause in medium and large breed dogs is tracheal collapse, a condition where the cartilaginous rings of the trachea soften and flatten under the negative pressure of inhalation, causing the tracheal wall to collapse inward and produce the characteristic honking sound. In small breeds, tracheal collapse is endemic, and the honking cough is one of its most classic presentations. The threshold. A single honking episode that resolves within 30 seconds and is not accompanied by respiratory distress is a sound to note, document, and mention at your next veterinary appointment. It is not necessarily a tonight emergency, but a honking cough that recurs multiple times within a single night, particularly if the episodes are lengthening, or if your dog appears to struggle to recover their breathing between episodes, or if the episode is followed by a collapse or extreme fatigue, requires emergency assessment tonight. Nighttime sound number 3. The wet, labored breathing. The sound. A breathing sound that is audible without placing your ear against your dog. A crackling, bubbling, or wet quality to each breath. Sometimes described as the sound of breathing through water. Sometimes compared to a bubbling or rattling that accompanies every inhale and exhale. The biology. Wet, noisy breathing with an audible crackling or bubbling quality indicates the presence of fluid in or around the lungs. This fluid produces the sound by interfering with the normal movement of air through the airways. The most common cause of sudden onset wet breathing in dogs is acute pulmonary edema, which is fluid accumulation within the lung tissue itself. Pulmonary edema in dogs is most commonly caused by congestive heart failure, where a failing left ventricle allows fluid to back up into the pulmonary circulation and leak into the lung tissue. It can also be caused by respiratory infections, toxin inhalation, near-drowning events, and certain neurological emergencies. The threshold. There is no safe threshold for wet, labored breathing with an audible fluid quality at night. This is a go-now sound. The presence of fluid in the lungs producing audible respiratory sounds at rest is a respiratory emergency. Do not wait to see if it resolves. Do not wait for morning. Go directly to an emergency veterinary clinic. Nighttime sound number 4. The repetitive dry retch. The sound. A repetitive, non-productive retching motion and sound. Your dog is heaving. Their abdomen is contracting rhythmically. Their neck is extending. The motion of vomiting is happening without the production of vomit. Over and over. Every 30 seconds to a minute. With your dog becoming visibly more distressed with each episode. The biology. Non-productive retching, also called unproductive vomiting or dry heaving, in a dog at night is one of the clinical sounds I take most seriously in emergency medicine. The most feared cause of non-productive retching in dogs is gastric dilatation volvulus, commonly called GDV or bloat. GDV occurs when the stomach fills with gas and then rotates on its axis, trapping the gas inside and cutting off blood supply to the stomach wall and to the spleen. It is the most rapidly fatal condition in dogs. A dog with GDV can progress from first symptoms to death in 2 to 4 hours without surgical intervention. The threshold. Non-productive retching that has occurred more than twice in the past 30 minutes, in a medium or large breed dog, particularly a deep-chested breed such as a Great Dane, German Shepherd, Labrador Retriever, Standard Poodle, or Weimaraner, is a go-now emergency. Do not wait to see if they vomit something and feel better. Do not give water. Do not wait for morning. Call the emergency clinic while you are already getting your dog to the car. Nighttime sound number 5. The distressed whimper or cry. The sound. A low, repeated whimpering. Or a sudden sharp cry. Or a sustained vocalization of pain or distress that your dog does not normally produce and that has no obvious external trigger. Not the whimper of a dog that wants to come onto the bed. The whimper of a dog that is hurting. The biology. Dogs are stoic animals with a high pain threshold and a powerful biological drive to conceal discomfort. A dog that is vocalizing pain spontaneously, without being touched, without being provoked, has exceeded the concealment threshold. The pain producing the vocalization is beyond what their system can manage silently. This level of pain can originate from multiple sources including acute joint injury, disc herniation producing sudden spinal pain, abdominal pain from any of the gastrointestinal emergencies we have discussed, urinary obstruction producing bladder pain, and cardiac pain associated with aortic conditions. The threshold. A sharp cry that occurs once during repositioning at night, without recurrence, is likely a positional pain response from a joint or muscle that can be assessed in the morning. Sustained, repetitive, spontaneous whimpering or crying that does not resolve within 5 minutes of your dog settling is a pain level that requires assessment. Tonight, if accompanied by any other sign. This week at absolute minimum if isolated. Nighttime sound number 6. The rapid, shallow breathing. The sound. Breathing that is faster than normal, visibly shallower than normal, and that you can see as well as hear. The chest or the sides moving more rapidly than they should at rest. If you count the breaths per minute and find a number above 40 in a resting dog, you are hearing and seeing rapid, shallow breathing. The biology. Rapid, shallow breathing at rest, called tachypnea, is produced when normal breathing is insufficient to maintain adequate oxygenation or to clear carbon dioxide from the blood. The body compensates by increasing the respiratory rate. The underlying causes of nighttime tachypnea include anemia, where reduced red blood cell count limits oxygen carrying capacity. Pleural effusion, where fluid accumulation in the space around the lungs restricts their expansion. Pneumothorax, where air has entered the chest cavity outside the lungs and is compressing them. And severe pain, which drives rapid, guarded breathing as a protective response. The threshold. A resting respiratory rate above 40 breaths per minute at night is a clinical finding that requires veterinary assessment. If this respiratory rate is accompanied by visible breathing effort, pale or blue-tinged gums, or collapse, this is an emergency tonight. Nighttime sound number 7. The vocal sleep disruption. The sound. Sudden, brief vocalizations during sleep. A sharp bark, a whimper, a cry that your dog produces while apparently asleep and that wakes them or wakes you. Sometimes accompanied by paddling of the limbs, twitching, or a brief episode of apparent confusion upon waking. The biology. This sound has two completely different biological origins that look almost identical from across the room and require different responses. The first is normal REM sleep behavior. Dogs dream. During REM sleep, normal dogs vocalize, twitch, and move in ways that reflect the dream content. This is a completely benign neurological phenomenon. The second is a focal seizure. Focal seizures involving the temporal lobe can produce brief vocalizations, facial twitching, lip smacking, and a postictal period of confusion that occurs during apparent consciousness rather than during obvious seizure activity. The threshold. A single brief vocalization during sleep that resolves immediately, and from which your dog wakes and orients normally is almost certainly REM behavior. Multiple vocalizations within a single night, or a vocalization followed by a period of confusion, disorientation, lip smacking, excessive salivation, or apparent blindness upon waking, are seizure indicators that require a veterinary appointment tomorrow morning and an emergency assessment if the episode recurs or extends beyond 90 seconds. Welcome to Chapter 3. The Middle of the Night Assessment Protocol. You have heard a sound. You are awake. Your dog is the source. Here is the precise, 3-minute sequence of observations that gives you the information you need to make the right call. Assessment Minute 1. Identify and locate. Turn on the light. Find your dog. Note their location and position. Are they standing when they should be resting? Are they unable to find a comfortable position? Are they in a location they do not normally occupy at night? Positional restlessness, the inability to lie down and stay down, is one of the most consistent accompanying signs of serious abdominal or pain conditions. Note the time. Every observation from this point forward needs a timestamp because the duration and progression of symptoms are the most critical pieces of information your emergency veterinarian will ask for. Assessment Minute 2. The respiratory check. Place your hand on your dog's side or watch their chest and count breaths for 15 seconds. Multiply by 4. Write down the number. Above 40 in a resting dog is abnormal. Above 60 is a critical emergency. Look at the color of their gums. Lift the lip. Pink and moist is normal. Pale pink or white indicates poor perfusion. Blue or gray indicates severely compromised oxygenation. Any color other than normal pink in combination with any nighttime sound is an emergency clinic situation. Listen to the quality of the breathing. Is it quiet and even? Or does it have an audible wet, crackling, or labored quality? Audible wet breathing is a go now finding. Assessment Minute 3. The abdomen check. Look at your dog's abdomen from the side. Does it appear more distended or rounded than normal? Is one side more prominent than the other? Press very gently on the abdomen with your flat hand. Does your dog flinch, tense, or cry? Abdominal distension combined with non-productive retching or extreme distress is GDV until proven otherwise and requires immediate emergency care. Feel the gums with your fingertip. Press for 2 seconds and release. The color should return within 2 seconds. A return time of longer than 2 seconds indicates circulatory compromise and is an emergency finding. 3-minute decision. After these 3 minutes of assessment, you have 4 pieces of critical information. Respiratory rate, gum color and capillary refill time, presence or absence of abdominal distension, and the character and frequency of the original sound. With these 4 pieces of information, cross-reference with the 7 sounds from Chapter 2 and the emergency thresholds from Chapter 4. Your decision to wait or go should be based on data, not on the time of night or the inconvenience of the decision. Call the emergency clinic if you are uncertain. Every veterinary emergency clinic has a triage line. A 60-second phone call with your observations described clearly will tell you whether to bring your dog in immediately or whether it is safe to monitor until morning. Make that call before you decide to wait. Welcome to Chapter 4. Sounds that mean you are already going. These are the combinations that remove all ambiguity. Any one of these presentations means you get your dog to an emergency clinic. Tonight. Now. Without waiting for any additional signs to develop. Non-productive retching more than twice in 30 minutes in a medium or large deep-chested dog. This is GDV until proven otherwise. Every minute between first symptom and surgical intervention matters enormously for survival outcome. Any audible wet, crackling, bubbling quality to breathing at rest. Fluid in the lungs does not wait. Gum color that is pale, white, gray, or blue at any point during your assessment. Gum color change is a circulatory or oxygenation emergency at any hour. Collapse or extreme weakness alongside any sound. A dog that cannot stand or maintain posture has a systemic failure that is not going to resolve by morning. Any sound accompanied by a resting respiratory rate above 60 breaths per minute. At this respiratory rate, the body is in compensatory overdrive and decompensation, which is the failure of the compensatory mechanism, can happen rapidly. Continuous vocalization of pain that does not resolve within 5 minutes and is not associated with an obvious, resolvable trigger. A seizure episode that lasts more than 90 seconds, or that is followed by a second seizure within the same night. Status epilepticus, which is prolonged or clustered seizure activity, is a neurological emergency. And if your gut tells you that something is profoundly, catastrophically wrong, trust it. You know your dog's normal. A dog that feels wrong at 2 in the morning is a dog that warrants the emergency clinic visit even if you cannot name the specific clinical finding that triggered your concern. Your instinct about your dog's baseline is clinical data. Treat it as such. You came here at some point between reading this title and pressing play knowing that this video might be exactly what you need and hoping you never have to use it. Because the best version of watching this video is watching it before the night it matters. Absorbing the 7 sounds, learning the assessment protocol, understanding the non-negotiable emergencies, while your dog is sleeping peacefully nearby and nothing is wrong. Because the version of you who watches this video before the night it matters is the version who already knows, when the sound comes, what to listen for. Who can be awake and assessing within 30 seconds instead of spending 5 minutes in confused, half-awake uncertainty. Who knows the difference between a honking cough that needs a veterinary appointment next week and a honking cough that needs the emergency clinic in the next 30 minutes? Who knows that wet, crackling breathing has no safe threshold and that dry heaving in a Great Dane at 2 in the morning is not something that waits for the regular vet at 9? That version of you saves your dog's life. Not dramatically, Not heroically. Just by knowing. By having heard the sound described in clinical terms before you heard it in the dark. By having the respiratory rate threshold written somewhere accessible. By having the gum color check built into your assessment muscle memory before your hands are shaking in the middle of the night trying to remember what you were supposed to be looking for. Your dog cannot make this decision. They cannot assess their own symptoms. They cannot calculate whether the retch happening in their stomach is the kind that passes or the kind that has a 2 to 4 hour window before it kills them. They are completely dependent on you to make the right call at the right time with the right information. You are the variable that determines the outcome of what happens in the dark. Not the emergency clinic. Not the veterinarian. Not the medication or the surgery or anything that comes after. You. The person who heard the sound. Who got up. Who turned on the light. Who ran the 3-minute assessment. Who made the call at 2 in the morning because they knew enough to know that 2 in the morning was the right time to call. That is what this video is for. That is what Paw Secrets Lab is for. Giving you the information you need, before the moment you need it, so that when the moment comes you are already the informed, capable, decisive person your dog needs you to be. Tell me in the comments below. Have you ever heard a sound from your dog at night that scared you? What did you do? Did you wait until morning or did you act? Your story might be exactly the piece of information that gives another dog owner, lying awake right now turning the same question over, the courage and the clarity to make the right call. If this video gave you a framework you hope you never need and know you are grateful to have, please tap the like button. It tells the YouTube algorithm that emergency preparedness education for pet owners matters and it carries this video to the families who have a dog making a sound right now that they do not know how to read. Subscribe to Paw Secrets Lab and join our incredible, growing community of educated, devoted dog parents who prepare for the moments that matter before those moments arrive. I am Dr. Patrick Sullivan. Learn the 7 sounds. Practice the 3-minute protocol in your mind before you need it in the dark. Know the non-negotiable emergencies. And keep the number of your nearest emergency veterinary clinic somewhere you can find it at 2 in the morning without having to search. Your dog is counting on you to know this before they need you to know it. I will see you in the very next video.